Dr. Matt.
Hi, I'm Dr. Matt. I'm here with Abigail today. She's helping me out. I wanted to show you, Abigail, my cool new armband.
It looks amazing. Amazing. Looks like you might have lateral epicondylitis.
Lateral Epicondylitis. Yeah. Okay, now what is that? Give you a clue. It's something to do with the forearm and tennis elbow. All right, tennis elbow. So lateral epicondylitis. If we look at the elbow, we go front on, the outside is the lateral, okay? And these are condyles in the joints, and on the outside is the epicondyle. So tennis elbow or lateral epicondylitis comes from inflammation and swelling and a strain on that lateral epicondyle, on the bone itself. So I've got a little bit at the moment, so I thought we'd do a little bit of treatment on it. You up for that?
Great. What's on top?
Well, first thing, you might have seen people wearing these cool armbands. And the idea of that is the muscle here is pulling on that bone. The bone attaches there, it's its anchor. And as you're using this muscle, which goes all the way down the forearm to the fingers, anytime you're lifting the arm up in that sort of motion, you're putting this muscle under strain, or grabbing something that is pulling the other way. It's going to put the muscle under strain. And it's an overuse injury. Okay, so one thing we can do.
Sweatband.
Well, this is true. This is my McEnroe days as well. So it's pulling on that bone. So what we want to do is we put a brace there. We can shorten the muscle, and it's going to give this area a little bit of a rest. Okay, so it's not really going to fix it, but it's going to allow a bit of pain relief, so you can still maybe play your tennis, and just take that area, give it a rest, as I said, so we can heal a little bit better. It's not really fixing the problem, but for starters, you'll often see people do this. It's quite simple. You can buy these at the pharmacy or the chemist. I'm strapping it up just below the bone. Okay, so we'll use an arm brace. This is our first thing. So we're going to go through all the different things we can do to help, and we're going to demonstrate them over time. All right, so I'm going to do this brace up really tight, like almost as tight as I can. And you might want to use this while you're playing tennis. Now, the reason it's called tennis elbow is because it's when you're using this arm and you're lifting the arm up. It's coming loose there. It's not quite tight enough. So you're using this arm, all right? And so gripping the tennis rackets is one of where it gets its name, but more commonly it's seen when you're typing, things like that, or repetitive. Carrying shopping bags, gripping the steering wheel, gripping anything really tight, maybe a hammer, things like that, or a screwdriver. Tradies will get it a lot. So a brace is a temporary relief, a little bit of a rest period. Use it under periods of extreme strain. It's pretty cheap and effective, but it's not really getting to the cause of the problem. So let's add a few more things to our list. Okay, what else are we going to do for lateral epicondylitis? Any ideas? Ice pack. All right, let's put it on the list.
Heat pack.
Ice pack. I just said ice pack. You said heat pack. Ice. What do you do? Ice or heat? Good question. There's no real right answer. Sometimes the ice helps if it's really tender, really inflamed. It is an inflammation, so it can be so sore you can barely touch it and bump it and it's screaming. So if you put an ice pack right on the bony point there or just below it, it's going to help decrease that inflammation. So you might want to wrap an ice pack up in a wet tea towel, put it there for about 10, 15 minutes at a time. Bag of peas. Yeah, not tin peas. Just bag of peas. All right. Ice pack. Now, next on the list, heat pack, you said. Okay. Well, why heat? We just did ice. It's the opposite. The benefits of heat is it's going to increase the blood supply and relax the muscle. So heat tends to relax muscles. Bringing the blood supply to the area is going to increase the healing to the area. Okay, so we can certainly put a heat pack on as well. Okay. Now, next thing we want to do is try stretching out the muscle. Okay, so because it's a muscle where stretching, we're pulling back into extension of the lateral forearm. We want to do flexion. Okay, so for that, we want to strengthen our arm, let our fingers dangle loose, and pull the fingers down like this. Okay, so we're getting a full flexion of this muscle like that. You might want to push it against the steering wheel in the car, at the lights. Every time you're at the lights, give it a bit of a stretch like that. Okay, you might want to get a friend to help you, limp-wristed.
Is that something you do regularly? You do that a couple of times a day, or just when it's...
Several. So push below where the fingers are and push forward a bit harder, until you feel a light stretch, and then just hold it for about 20 seconds, 30 seconds, okay? Shouldn't be too painful, but again, if it's not strong enough, it's not going to work at all, okay? Now, another approach is you can actually work on strengthening the muscles, okay? So we might want to do some weights as well. Now, again, it's counterintuitive. We're stretching and relaxing it, now we're strengthening it. It's a bit like the heat and the ice, but we're trying everything we can. But when it's in the less acute phase, we might want to do some weights and extend the elbow as well, okay? Next thing, I want to get some massage done. So I'm going to see a massage therapist to work on the muscles there. We're going to do some different release techniques. I'm going to see dry needling, which is an acupuncture type technique. Who's going to do some release again of the muscles and the knots in through there. And another technique, so we put dry needling. So that's inserting the acupuncture needles into the muscle, is low-level laser therapy. Okay, so I want to try some low-level laser. The laser is designed to stimulate the healing in that area. So we'll get into that as well.
Now I see you sitting in here as well with a
Scraping.
little stone, scraping away.
Okay, so scraping is another massage type technique. We can call that gua sha, the ancient Chinese method. More modernly, it's called instrument-assisted soft tissue manipulation or mobilization. So that's a scraping technique where we can scrape the muscles. So we'll try that as well. Gua sha, dry needling or spoons, whatever you want to use. Okay, different techniques. Okay, is that about it?
That's a good list.
Okay, that's a good list. Now, the other thing you could do is medication.
Pain relief.
Well,
Yeah.
pain relief. You got a message going from the elbow to your brain saying it's painful. You could take some medication to say it's painful. Now, I don't recommend this as a first line of attack because it's not really fixing anything. Okay, but to get some pain relief, you can block those signals. We're not fixing the problem at all, so you want to be careful with that. And it's not a long-term solution. So that's why I put it on the bottom of the list. But some people put that at the top of the list. So I recommend against that. But that's up to you. Let's do the non-invasive techniques first of all.